todas las personas que nos acompañan en el webinar número 236, desde que el Organismo Andino de Salud, Convenio Hipólito Unanue, inició el ciclo de webinars en mayo del 2020. Son más de 4 años de interaprendizaje continuo. Hoy es grato
Today,
presentar el
we are
webinar
pleased to present the webinar entitled Closing the Gap, Breastfeeding Support for All. In 1971, with the creation of the Hipólito Unanue Agreement, the governments of Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela joined together with a sense of solidarity and regional integration to make health a bridge for peace and work for well-being. Today, the Andean Health Organization, Hipólito Unanue Agreement, has an important trajectory of unity and constant work with the ministries of health of the 6 Andean countries towards the realization of the right to health. In the midst of technological globalization, the COVID-19 pandemic reaffirmed the relevance of the health sector for life well-being. That is why today it is a priority to keep health at the forefront of the policies and the social awareness to unite for a common good to advance in a society that cares for life. Health is the bridge towards integration and peace. For this reason, in the Strategic Plan for Health Integration 2023-2030 of the ORAS-CONU, we argue that to ensure the full realization of the right to health with social and environmental justice, it is key to work intensively on strengthening the health systems, always emphasizing primary health care. Reflections such as these and diverse information and the activities that we carry out at the Horas CONU can be found in the monthly edition of the Noti Salud Andinas newsletter, which we invite you to read, which is also available at the Horas CONU webpage and in the Andean Integration Knowledge Showcase. We invite you to leave your name, organization, and country in the comment box of the Facebook Live chat or YouTube Live. In that same space, you can leave your questions or send them via email to webinarhorasconu@gmail.com. To access the certificate of attendance in any of the Facebook Live or YouTube Live chats, you will find a fixed link where you will have to fill out a brief survey and leave your data. Please verify that your email address is spelled correctly in order to send the certificate, which will be sent to your email address within the following week. In this webinar, we will follow the usual dynamics. We will start with the institutional greeting, then the keynote speeches, to then finish with a dialogue based on the questions asked by the participants on the different platforms. To kick off this important day, I will now give the floor to Dr. Maria del Carmen Calle Dávila, Executive Secretary of the Andean Health Organization, who will give the institutional welcome and greeting. Dr. Calle, the floor is yours. Thank you very much, Magda. Well, good morning, good afternoon, good evening. Welcome you all to this 236 webinar organized by the Andean Health Organization Hipólito Unanue Agreement, which is part of the virtual events that we organize as part of the actions that we need to promote distance training of human resources, and the continuous interlearning actions that we carry out always as a priority. On this occasion, the Andean Health Organization has prepared this webinar entitled Closing the Gap, Supporting Breastfeeding for All. And this is part of the celebrations of the World West Breastfeeding Week, which is celebrated the first week of August each year. And in accordance with this year's theme, which campaign aims at highlighting the importance of how families, societies, communities, and health workers in general support each breastfeeding mother throughout the time they provide this benefit to their child. For this purpose, we will have three excellent speakers with extensive experience. Professor Joseph Haddad, President-elect of the International Pediatric Association, Professor of Pediatrics and Neonatology from University of Balaman, Lebanon, Dr. Leo Neverdeen, Regional Advisor on Food Nutrition and Physical Activity of the Pan American Health Organization in Washington, D.C., and Dr. Rosana Conti. She's a pediatrician and neonatologist advisor to the National Committee of Breastfeeding of the Argentinian Society of Pediatrics, to whom I would really like to express my deepest appreciation for being here with us. Less than half of newborns receive breast milk in the first hour of life, making them more vulnerable to illness and death. And only 44% of babies are exclusively breastfed during their first 6 months of life. This is a figure that falls short if you consider the World Health Assembly's target of 50% by 2025. Breastfeeding can serve as an element of equality in our society, and it is fundamental and essential to ensure that everyone has the necessary support and opportunities to breastfeed without excluding anyone, especially mothers in vulnerable situations who require greater support towards closing the existing gaps and inequalities. To close the gap and in existing inequalities for successful breastfeeding in all settings requires the determined and sustained involvement of all the stakeholders along the support chain, such as civil society organizations, communities, governments, policymakers, health systems, workplaces, and families, empowering parents for successful breastfeeding. It is therefore essential to ensure that breastfeeding mothers are not targeted by industry, marketing, or public health professionals who want to jeopardize their breastfeeding by promoting formula feeding. Protecting caregivers and healthcare workers from the influence of unethical marketing by the infant formula industry through the adoption and full implementation of the International Code of Marketing of breast milk substitutes is critical. Protecting, promoting, and supporting breastfeeding is more important now than ever, not only because as the baby's first natural and sustainable food system, we protect our planet, but also because we promote the survival, growth, and development of millions of infants. We can all help ensure that women feel able to breastfeed anytime, anywhere, and work to improve the position and status of women at home or at work and in public life. We would like to reiterate our gratitude to the three outstanding speakers that join us today and all of our participants from different Latin American countries and also from other continents who are joining us and also week after week. Welcome you all to this webinar.
Muchas gracias, doctora Calle.
Thank you very much,
Luego
Dr.
del
Kaye.
saludo de nuestra
After
Secretaría
the
Médica,
greetings
me
of our
presento.
Executive
Mi
Secretary,
nombre es Magda
I introduce
Hinojosa,
myself. I'm Magda
médica y
Hinojosa,
coordinadora del
physician
curso de vida
and life
en el
course
Andino
coordinator
Andino
at
de
the
Salud.
Andean Health
Y hoy con
Organization.
mucho
And
agrado
today,
estaré a
I will
cargo de
be in
la
charge
moderación
of
de
the
este webinar.
moderation of this webinar with
A
great pleasure.
continuación, para presentar la
Now, to
situación
present
de
the
la lactancia
situation of
materna en
breastfeeding in
América
the
y
Americas
políticas de
and
la OPS,
PAHO and
OMS, le
WHO
damos la más
policies,
cordial
we would like to
bienvenida al
welcome
doctor Leo
Dr.
Nederdin,
Leo
quien es un
Neverdeen, who
profesional con
is
el grado de
currently a
maestría en
professional with a
nutrición
master's
pública
degree
y
in public
estudios de
nutrition
innovación y
and innovation
comunicación,
and communication
cursado en la
studies
Universidad
from
de Wageningen en
Wageningen
los Países
University in the
Bajos.
Netherlands.
Para la Organización Mundial de la Salud
For the
y la
World Health
Organización
Organization and the
Panamericana de la Salud,
Pan-American Health
ha apoyado la
Organization, he has
preparación e
supported the preparation and
implementación de planes
implementation of
nacionales de
national
alimentación y
food and
nutrición en
nutrition
Cabo Verde y en la
plans
República
in
Dominicana.
Green Cape and in the
En
Dominican
Colombia,
Republic.
Ecuador y
In
Perú
Colombia,
ha
Ecuador, and
trabajado
Peru,
con
he
la
has worked
Organización
with the Pan
Panamericana de la
American Health
Salud, la
Organization,
Cooperación Holandesa
the
y
Dutch
la Unión
Corporation, and the
Europea en
European Union
diferentes
in different
proyectos
health
de salud,
projects,
apoyando la atención primaria de
supporting
salud,
primary
el
health care,
desarrollo de
the
espacios
development of healthy
escuelas
spaces
saludables
and
y la
schools,
reforma y
and the reform
descentralización del
and
sector.
decentralization of the sector.
Trabajando en la sede del Programa
Working at
Mundial de
the
Alimentos,
World
ha
Food Program
apoyado a los
headquarters, he has
programas de
supported
Kenia,
programs in
Indonesia
Kenya,
y Colombia
Indonesia, and
y
Colombia
también de
in their
programas de
implementation
operación
of
y
health,
capacitación en salud,
hygiene, and
higiene y
nutrition education
nutrición
and
para los
communication
escolares
programs
y la
for school
comunidad
children
educativa.
and the education
Además, ha
community.
trabajado
He
en la
has also
sede de
worked
la
at the World
Organización
Health
Mundial de la Salud,
Organization
apoyando a los
headquarters,
países en la
supporting countries in the
preparación de
preparation of
planeación
action plans
basados en la
based
Estrategia
on
Mundial
the
sobre
global
Nutrición
strategy
y
on diet,
Actividad
physical
Física y
activity,
Salud,
and health,
particularmente en el área de la
particularly in the
Estrategia
area of
Poblacional para la
population-based
Prevención
strategies
de la
for the
Obesidad Infantil.
prevention of childhood obesity.
Actualmente
He
trabaja como
currently works
asesor en
as the
alimentación,
advisor
nutrición
on food
y
nutrition
actividad
and
física en
physical activity
escuelas
in
por
schools
la
with
Organización
the
Panamericana de
Pan
la
American
Salud.
Health Organization.
Adelante, doctor Nedervin. Es
Go
suyo
ahead,
el
Dr.
espacio.
Nederveen, the space is yours.
Muchas gracias por esta
Thank you.
invitación
Thank you
y
very much for
gracias
this
al
invitation, and
Organito
thank you
Andino
very
de
much
Salud
to the
por
Andean
llevar
Health Organization
este Semana Mundial de Lactancia
for paying
Materna que
attention to
inicia
this
hoy.
week, which has started
Voy a
today
compartir
in favor of
pantalla.
breastfeeding. I will share my screen now.
Me esperan un segundo.
Please bear with me.
Espero que ya puedan ver la
I hope
pantalla.
that you can now take a look at my screen.
Muy bien, adelante.
Gracias. Entonces,
Yes, thank you very much,
les
doctor.
voy a hablar en
I
esta
will now
presentación
speak
sobre la
during
situación
this
de
presentation
lactancia
about the
materna en las
situation of
Américas y
breastfeeding
también
in
les
the
daré un
Americas
poquito
and
de apoyo
also
a la
the
OMS.
policies which
Luego les voy
support
a
the WHO.
hablar
I
un
will
poco de
now
la situación
speak a little bit
respecto a
about the
la lactancia materna
situation
inmediata, exclusiva y
regarding
continuada.
exclusive, immediate, and continued
Además, voy a hablar
breastfeeding, and I will
de
also speak
intervenciones,
about the
cómo estamos
interventions
a nivel de las
as how
Américas
we are
con la
doing at
implementación
the in
del
the Americas
acuerdo
with the
de
implementation of the code
comercialización de kits de
of
bebés
the
para lactancia materna.
commercialization of
Comenzamos con la
breastfeeding
iniciativa Hospitales Amigos del
substitutes and
Mundo y
how we are
comenzamos en
doing with the
relación a
hospitals and how we
medidas
are
de
doing
protección
with
para
the
la
policies
mujer
for the protection of women
trabajadora.
who
Además, les
work.
voy a hablar un
And
poco
I
sobre
will
las
speak about
políticas.
the policies
Entonces,
then. Well, I think that we've heard and we know now about all the benefits of breastfeeding, and these benefits are both for the child and for women, and also for the international community and the development of the different countries. It is important to mention also that breastfeeding prevents all forms of malnutrition, including obesity and diseases, and it helps with the growth of children and brain development, and also intellectual coefficient of breastfed babies is much higher than others. Particularly, it is important to mention exclusive breastfeeding. This means mm, without any other j- liquid, even water, in the first 6 months of life. There's a goal, world goal, to reach 50% of exclusive breastfeeding in less than 6 months. It is something that we need to abide by 2025 at the level of Americas. We have an average of 32.3% of exclusive breastfeeding, but there's only 4 countries which are actually going beyond this 50%. It's Guatemala, Bolivia, Uruguay, and Peru. But there are other countries which are lagging behind with very much lower prevalences. We are improving if we compare these data in general, in the past years, there's been an increase in most of the countries regarding the percentage of exclusively fed babies, but this increase is not enough to reach the goal of 50% of exclusive breastfeeding in the different countries. In the first hour, breastfeeding is very important because of the colostrum, which is exclusive in terms of nutrients, and it helps prevent infections. And here we see the data of the percentage of newborns who are breastfed within the first hour of life. We have some data of the implementation of an initiative. I think that you are acquainted with this initiative, which consists of 10 steps of the health centers that they should comply with to be considered as a friend hospital. So there are 9 criteria that we use to consider whether these countries are complying with them or not. Under this initiative, it is important to have national leadership and very good coordination regarding this initiative. It is also important to implement policies and professional standards of care, especially with regards to quality care, always promoting breastfeeding, especially in the first hour, within the first hour of life, and avoid any marketing in favor or of formulas or milk substitutes. It is also important, and this is also a very important component, having health professional competency building or capacity building, counseling to mothers. And another important component is to have external assessment by a team of evaluators to define whether the hospital is complying or not with these 10 steps to be considered a
También
child-friendly
sí hay
hospital.
incentivos para los
Also,
países que cumplen
another
y
component
para los
is
países
that
que
of
no
incentives
cumplen.
and sanctions.
Otro componente que se evalúa es
We
la
also
asistencia
have
técnica
a component of technical
realizada a las
assistance
autoridades que participen en la
provided to
iniciativa.
the
Los
institutions that are part of
mecanismos
this
nacionales de
initiative,
monitoreo,
national mechanisms
si
for
hay
monitoring
campañas
whether
y buena
there's
comunicación y
communication,
advocacia
good communication and
y
advocacy,
financiamiento.
and if there's financing.
Podemos
Those are
ver
the
que
components. And we
el
can
código
see
verde para los
that
países
the
significa que
green
están
code for
cumpliendo
countries means
un
that they are
supuestamente este
complying
criterio.
with this
Y
criterion.
si está en amarillo es
And if it's in
parcialmente
yellow, it's
logrado
partially
y en rojo
accomplished. And red
no ha
means
sido
that they
logrado
are not there yet.
de
They
milagro.
have
Por
not.
ejemplo, en el
That means that
monitoreo a nivel
these
nacional
areas are
tenemos
considered
estos
a
incentivos
weakness.
y sanciones. En
So
general,
you can
el
see
liderazgo
those
nacional de
areas
comunicación está un
that
poco
are
mejor.
mostly
Estos son los
in
resultados
red.
del Caribe.
This is
Y
the
acá
Caribbean, and
pueden ver
here
los
you
mismos
can see
resultados,
the same results,
pero a nivel de
but
América
at
Latina,
the level
que en general está un
of Latin
poco
America,
mejor,
which are
pero sí
somewhat
vemos
better
que
than in the
el
Caribbean,
financiamiento
but we see
todavía
that
está
financing is
débil y a
still
menudo
weak,
dependiente de
and
financiamiento
oftentimes it
externo
depends
y no
on
un
external
financiamiento
financing. It's
estructural
not
del mismo
structural, it's not
Estado
domestic,
o
it's not
gobierno.
belonging to the government
Si
or
vamos
state.
al código
Now, if we move
de
on and take a look at
comercialización de
the
sucedáneos de la leche materna,
code,
eh, este código
this
regula
code
esta
regulates
comercialización.
the commercialization
Vemos
of these
que
products,
hay
and we see
19
that
países
there's
en las
19
Américas
countries in
que
the
han
Americas which have
establecido alguna
established
regulación
some
o ley en su país
regulation
en línea con el código
aligned
internacional.
to the international code.
Y de estos 19 países,
And from these
solo dos
19 countries,
países
there's
están
only two
sustancialmente
who
alineados
are
al código,
substantially
Brasil
aligned with
y
the code, which
Panamá.
is Brazil and
Pero
Panama.
16
But
países
there are
no
16
tienen ninguna
countries
medida
without any
legal, a pesar de
legal
que
measure,
este código ya
despite
lleva varias
this
décadas
code
luego
has
de
been
su
around
aprobación.
for some
Todavía
decades after its
casi la
approval.
mitad de los países en las Américas no
And
han
almost half of the countries in
adoptado
Latin America have not adopted
este tipo de
the national
control
implementation
la
of the
publicidad
international code
y
and
distribución
marketing
de
breast
los
milk
sucedáneos de la
substitutes.
leche materna. Y vemos también que
We
las
also see
Américas
that
no se compara bien
in the Americas,
con
this
los
is not
datos
well
observados
compared
a nivel mundial.
to the world.
Son los países que
These
están
are the
sustancialmente
countries
alineados
which
o moderadamente
are
alineados
substantially
o
aligned
tienen
or
alguna
moderately
parte del
aligned
código
or else have
incluido en
some
sus
code provisions included
leyes.
in their laws.
Vemos también el
We
tema
also
de la
see
protección de
here
la maternidad
this issue of
para
maternity protection
poder
and
tener
how
una
it's being dealt with
lactancia definitivamente
to
es
enable
recomendable que los países o
breastfeeding.
las
Well,
empresas den
the
por lo
companies
menos
and the countries
16, 18 semanas de baja
need
de
to
maternidad para las mujeres
provide maternity
que
leave
han
for
parido
those women
para
who have
primeras
given birth.
madres, digamos. Y también es
And it
importante
is
que
also
cuando
important
vuelvan a trabajo,
when they go back
que
to
haya
work, it
facilidades
is important to
donde
have
ellos pueden
on site
extraer la
facilities
leche,
where
que
they
haya
can
un horario también de lactancia materna que
follow
verifique
a
las facilidades
schedule
y bueno, con el
for their
programa de licencia de
breastfeeding
maternidad
strategies. And
ve
with
la
the
duración
maternity leave
solamente
status,
para
we see the duration
verificar
here. And this is something
esto
to
y
bear in
también
mind. And
el monto del salario que se sigue
the
pagando y
salary
el
that
origen del
is
salario, porque muchas
still
veces en
paid
realidad
and the
es
source of
muy
the salary.
importante
This is
para,
especially important
para la lactancia materna.
if we consider
Todavía hay mucho
breastfeeding. Still,
que
there's
avanzar en este tema
much to advance and move forward with WHO, PAHO, UNICEF, and the International Labor Office are all of them working very emphatically in these measures. There's also a collaboration w- between UNICEF and the WHO, and we are calling for the government's donors and partners to increase resources to achieve the World Health Assembly target of increasing the rate of exclusive breastfeeding of infants under 6 months of age to at least 50%. Also, to fully implement the International Code of Marketing of Breastfeeding Substitutes and subsequent relevant solutions. And well, this is important to mention because it defines the breast milk substitutes. Any liquid might be partially competing or totally competing with breastfeeding. And we are considering products that are given to infants up to 36 months of age, not 12, as some companies interpret in some cases, but breastfeeding is recommended for at least 6 months and exclusive breastfeeding. But after that, continued breastfeeding goes up to 2 years or more of age. So this is why it is important to bear all of these products in mind, which compete with breastfeeding. They are high in sugars and some fats, which are not beneficial for the development of children. Well, now we also call upon implementing the 10 steps to happy breastfeeding in maternity hospitals, also improving access to trained breastfeeding counselors, approve maternity protection laws, including leave of absence and breastfeeding policies in the workplace, strengthening links between health facilities and communities, creating monitoring systems to track the progress of policies, programs, and also the financial resources to achieve national and global goals.
Y finalmente los sistemas de monitoreo para que haya seguimiento del progreso de las políticas,
There
programas
should be progress monitoring of all of these institutions.
Bueno,
Well,
en términos del código, entonces importante que
it is
exista una
important
legislación
to
nacional
have a
que hay que
national
fortalecer las
legislation.
instituciones y
We need to
regulaciones
strengthen the
existentes,
existing laws and
especialmente
regulations. As I
todos los
mentioned,
productos para niños
we
y
need to
niñas
include all the products for young
daños,
children up
prohibir
to
la
3 years of
propaganda
age, ban
de
advertising,
artículos sustitutivos de la
including
leche materna,
electronic
incluir
advertising of milk
la promoción
substitutes.
digital, que antes la mayor parte
This
de
is
la
something
propaganda era
that
por
did not exist
anuncios de
before,
horarios
but
y comidas,
now
pero
electronic
actualmente es más por
advertising is very
internet y
trendy
los medios
on internet
sociales.
and social media.
Prohibir cualquier
We need
donación
to
de
prohibit
muestras
any
y regalos,
donation of samples
pero
and
más
gifts,
importante que la
but more
legislación es el
important
monitoreo
is
de la
monitoring.
implementación, que les voy a
Monitoring
mencionar un poco más
and the
sobre esto en los
enforcement
próximos momentos.
mechanisms.
Sí, les quiero hablar de este
I would
conjunto
like
que
to
es
speak about the
conjunto de herramientas NetCode, que es una
Netcode,
colaboración entre
which
órganos de
is a
UNICEF y varias
collaboration between UNICEF,
organizaciones civiles
WHO, and
que incluye un
many civil
protocolo.
society organizations. There are some codes here and products.
Hay un protocolo
There's
para la
a
evaluación
protocol
periódica
for
y
the
este es un
periodical
protocolo
monitoring. This
de
is
encuestas que muchos países de las
surveys that
Américas
many
han
of the
hecho.
countries of the
Es
Americas
una
have done.
evaluación
This is a quantitative
del comportamiento
assessment of the
significativo.
behavior,
Eso ayuda como
and
una
it helps. It's
metodología estructurada,
a structural
adaptada
methodology, if you will, which has been
a identificar
standardized.
las
It
tendencias
helps
en el
in
tiempo
assessing
y nos
trends
permite hacer
with
comparaciones
time.
entre los
It
países
compares the
y
different
ayuda
countries
a
also, and it
identificar
helps in
prioridades
identifying
y también
priorities and also
identificar limitaciones reglamentarias
identifying
y reglamentos.
limitations
Ayuda también
and
a
pitfalls on the
advocacia
laws and
en caso de ser
regulations, and it
cambiar o
helps with
fortalecer una
advocacy
ley
if it's
existente.
necessary
Tiene un
to
módulo relativo
perform.
a los valores y
There's
los
a
establecimientos de salud
module which is
sobre
directed to
una serie
mothers and health
estratégico que está
centers
cumpliendo con
to see
el
if the
código
health
más que todo
staff is compliant
y
with the
también hay
code
un módulo
mostly, and also
relativo a
there's
la
a
venta al
module
por
which is
menor,
related to
y
the
etiquetado a través de
labeling
encuestas en
and retail
supermercados
sale.
y
There are surveys at the
farmacias y un
supermarkets and
módulo
the
relativo a los
pharmacy
medios de
stores, and
comunicación
there's
y
also a
planificación
module that
de
relates
Internet.
to television and internet.
Y mencionar acá también que hay
We would like to mention
otro
as well
protocolo
that
que es
there's
para el
another
sistema
protocol
de
which is
seguimiento
for
permanente de nuestro
ongoing follow-up
código.
of this net code.
Y con eso podemos
And with
detectar
this, we can
infracciones,
detect
digamos,
if
en
there have
tiempo
been
real y denunciarlas. Y esto es lo
problems
que
and
tal vez en
spot
este
them
momento
on
lo que
time.
más se necesita en
Maybe this is
esta
what we need the
región y
most
también
in
para que
this
haya
region, and also
sanciones efectivas.
implement effective sanctions whenever
Quiero
they are not
mencionar
complying
también
with
que se
this
lanzó
code.
hace un año un documento
1 year ago, there
dirigido a
was a
nivel
study,
mundial
a
donde
document
explicamos
launched
que
worldwide,
las
where
empresas
we saw that
productores
the
de
companies that are
leches infantiles
producing
gastan
formula
55.000
spend
millones de
$55
dólares al año
billion
en
dollars
publicidad.
a year
Entonces,
in
realmente estamos
marketing and in
ante
advertising.
una
We are
industria
facing a
multimillonaria
multi-millionaire industry here,
es muy importante
and it
que
is hence very
tengamos
important
buenas
for
leyes y
us to
buenos
have good laws
reglamentos
and good
para evitar
regulations
esto,
to
porque
fight this
si no, no hay
scourge,
otra
because
forma,
otherwise there
porque
won't be any other way to fight them.
está induciendo a muchas de las
This is
mujeres
inducing
para
women
dejar de
to
alimentar
leave
hijos
breastfeeding
a los
aside
niños.
and providing other
Quiero mencionar
fluids to their
también
children. I
que
would like to mention as well
2019
that in
se lanzó
2019
una
there was a
nueva
launch of a new
actualización de la iniciativa Hospital Amigo del
update
Niño.
of the
Y
baby friendly
lo
hospital
principal
initiative.
es que
The main thing
se
here
ha manejado durante mucho tiempo como una
is
iniciativa vertical,
that
un poco
this has
aparte
been a vertical initiative for a long time.
de los ministerios de salud, pero en realidad con esta
But
nueva guía
actually,
lo
with
que se
this new
pretende es
guide,
que
what we
haya
are
cobertura universal en salud
pretending
y
is
también
to
haya
have
cobertura
universal
universal
coverage in
desde
health
hospitales
and
hasta
also
niños, porque en realidad
universal
esto es lo
coverage of
más
baby
como
friendly
la lactancia
hospitals
materna en
to promote
los servicios
breastfeeding and their
deben ser
services.
cumplidos por todos los servicios y
All
no
of the services
solamente por
need to
los
comply with
servicios
this
que participen en una
initiative.
iniciativa Hospital Amigo del Niño. Entonces es importante integrarlo,
It is
transversalizarlo en las
important
políticas
to
nacionales y
integrate
tener fondos también
all of
nacionales
these
destinados a esto para que la
policies. It is
iniciativa sea
important
sostenible.
to make this initiative sustainable.
Nosotros como OPS
As
estamos
PAHO,
dando apoyo
we are
continuo a esta
providing ongoing
iniciativa.
support
Estamos
to this
creando
initiative.
o hemos
We
establecido
have
redes
established
de la iniciativa para
networks
América Latina
for
y el
Latin
Caribe
America and the Caribbean with
profesionales
the
de salud
participation
de los
of
ministerios de
health
salud
professionals from the
y
ministries of
intercambio
health,
la información y
where
experiencia.
they share
Damos
experiences and
capacitación a
information.
la
We
iniciativa,
train
damos a
people at the initiative.
capacitadoras
We
y
train
también a
trainers.
evaluadoras
We
para
also
las
train
políticas internas.
evaluators for the external
Estamos preparando
evaluation
un
of this.
curso
We are
junto a
preparing
UNICEF.
a course together
Se va a hacer
with
un curso
UNICEF. This will
en línea,
be
un
an
curso
online
virtual
course. It
de
will be a
acceso
virtual course
gratuito
free
y
access,
estamos
if you will,
traduciendo
and we
también
are also
estas pistas a
translating
través de
the
traducción
WHO's
de la OMS
training
al
tools
español
into
y
Spanish.
tenemos también una guía para
We
evaluar las
have
competencias
a guide
importantes.
for
Damos apoyo al
competency assessment.
monitoreo
We
y
support
evaluación
ongoing
de
monitoring and
organizaciones
evaluation and also
establecidas en la comunidad,
re-evaluation of maternity facilities.
revisando herramientas y
We
promocionando
have
la asistencia para
tools to
identificar
review,
las
and we are
necesidades
providing
culturales
assistance to
para su
countries
mejor
to identify
integración
needs and opportunities
y
for
llevar a
further
escala la
integration and
iniciativa
bringing the
de
initiative to scale
desarrollo como
as part
parte de
of
los
the efforts
esfuerzos para alcanzar
to achieve
cobertura universal en salud.
universal health
Acá
coverage.
pueden observar
Here you can see
algunas nuevas
some
herramientas
of these
recién
new
traducidas
tools
al
that we
español.
have
Están
recently
todos
translated
disponibles
into
en
Spanish.
nuestra
All of them are available
página web
on
de
our
la
website,
OPS.
the PAHO
Simplemente
website.
buscan por el tema
You
de
just
lactancia materna y
simply
van a
search
encontrar todos
breastfeeding
los
and you will
documentos.
find all
Hay
of
un
these
nuevo
documents
curso
for
de
you.
capacitación
There's a
sobre
new
la
training
iniciativa
course on
hospitalaria
the
femenina para
friendly
personal a
hospital
maternidad, que reemplaza el
initiative
curso anterior de 20 horas
that
semanal.
will replace the
Hay un
20-hour
documento
course that
reciente
existed before. There's a
con
recent
atención
document
especial de
with a
protección de
special
nacidos
attention
pequeños,
on
enfermos o
newborns who
prematuros.
might be
Y
premature
está
or ill.
también recién
And
traducido el
there's
conjunto de
we've recently
verificaciones
translated the verification
competentes de los
tools.
prestadores de atención directa. Y bueno, esta
And
guía
well,
para la
this
aplicación
guide
digital del
for the
2018 que reemplaza la guía
2018 guide that
anterior.
replaces substitutes the
Y
previous one.
termino
And well,
acá
I
y
finish with this.
agradezco nuevamente a los organizadores
And I
de
would
este
like to thank
evento
the
y
organizers of this event, to
les
this
deseo a
webinar.
todo el mundo
I
una
wish you all
semana
a
muy
very happy
de
week,
lactancia materna y estoy disponible para
breastfeeding week, and I'm
cualquier
here
pregunta.
to answer any question that you might have. Dear Dr. Netterveen, thank you very much for your interesting dissertation. We have been able to recognize the worrying figures in the indicators of breastfeeding. It is important to highlight the low levels of breastfeeding prevalence in our countries in the Americas. Though Peru is in the best place with a prevalence of 65%, it is far from ideal. We need to work more. You have talked about how the implementation of the initiative for the humanization of birth and breastfeeding care, HIHAN, which is part of the international strategy of the Baby Friendly Hospital Initiative, was launched by the WHO and UNICEF in 1991. It's concerning to witness the poor financing provided by the country, especially in Latin America. It is also necessary to emphasize that in order to reduce the gaps in breastfeeding, all the facilities might be provided for the working women. But however, the figures that you have shown us are discouraging. We still have countries that do not allow adequate leave time to exercise the right or do not ensure 100% payment of their salaries during their absence, even without any legal support for breastfeeding hours. Policies in support of breastfeeding should be strong. This is how you put it. We need to fully implement the International Code of Marketing of Breastfeeding Substitutes, implementing the 10 steps to happy breastfeeding in maternity hospitals, passing maternity protection laws, including work leave and workplace breastfeeding policies, and many other aspects that need to be strengthened as well. Dear Dr. Netherveen, congratulations for your excellent presentation. And please, we ask you to stay in the room. We have already received many congratulations, comments, and very interesting questions that we will answer at the end. Next, to present on the policies and strategies in favor of breastfeeding towards closing the gaps, we welcome Dr. Professor Joseph Haddad, President-elect of the International Pediatric Association, IPA, Professor of Pediatrics and Neonatology at the Faculty of Medicine at the University of Belém, Beirut, Lebanon, past President of the Union of Arab Pediatric Societies from 2017 until 2022, past President of the Union of Middle East and Mediterranean Pediatric Societies, former Vice President of the Association of French-Speaking Pediatricians, former President of the Lebanese Society of Pediatrics, and Vice President of the Arab Neonatology Forum 2006-2008. Also President of the Lebanese Society of Perinatal Medicine until 2002, advisor to the Ministry of Social Affairs, Labor and Environment in Lebanon from 1998 to 2004, General Coordinator of the Global Movement for Children, Lebanon, Yes, UN Campaign 2001, National Representative of the Lebanese Republic to the World Summit for Children, UN in New York 2002, member of the Superior Council of Disabled People, Ministry of Social Affairs, Lebanon 2010, among many, many other high-level positions, several research studies, and index books and publications. Go ahead, Professor Haddad. The floor is all yours.
This is me. I will cut off the camera because I think it will be better for the video, for the audio. Permítanme, en primer lugar, agradecer a los organizadores de este seminario web.
Allow me to thank the organizers of this web seminar.
También el cordial saludo de International Pediatric Association y también nuestro fuerte apego a la lactancia materna que constituyó para nosotros una prioridad y en deber luchar por mejorar la instancia global de la lactancia materna entre nuestras madres. So this is my introduction in Spanish. Hope it was at least comprehensive. So,
sí, claro que.
Okay. How to make breast is the best. Dr. Leo has emphasized on a lot of policies. I may reiterate some of them and may add, but he was very global, and I thank him very much for introducing this important topic. So sustaining breastfeeding together is actually the World Breastfeeding Week item, team. Next slide, please. The next slide. So, let's start by what Dr. Leo has emphasized earlier, the paid parental leave. And this will provide adequate paid parental leave for both mothers and fathers. And if you look actually to the map of the paid parent leave, you will be astonished that the northern countries are really highly implicated in paid parental leave, whereas the southern countries are less implicated. And that means that maybe those countries who have a high socioeconomic level and can allow this paid parental leave, and those who are unfortunately in low and middle income countries, unfortunately, has not the power or the possibility to pay that parental leave. That is very, very, very important. That's one of the backbone of the breastfeeding. Next slide, please. Next slide. Next slide. Yes. And we have one of the others policies as breastfeeding friendly workplace. Breastfeeding has to be welcomed everywhere. It should be implemented for accommodation to breastfeeding in a private and clean lactation rooms. They should have flexible break times and the option to express milk during work hours. That certainly impact and help working mothers that want to continue breastfeeding after returning to work and support their ability to balance work and nursing. We should tell those mothers, we should tell them that you have the possibility to do that and you should implement it in your workplace and you should work for it. Next slide. Next slide. Next slide. Yes. Healthcare provider support is another policy. We have to ensure that healthcare providers will receive a good training on breastfeeding support and counseling. That's very important. And this will provide for the new mothers accurate information, practical advice, and encouragement, which can increase breastfeeding initiation and duration. So the healthcare provider should be supported, should be continuing medical education program should be certainly implemented in their premises. Next slide. Next one. Next. And here, Dr. emphasized on hospital policies. Yes, baby-friendly hospital initiative is highly appreciated and to be implemented in many, many countries. But unfortunately, there is a big problem in that issue. And the main problem is concentrated on financial implication. Financial implication and with breast milk substitute companies. And you are all aware about that. So we have to enforce the baby-friendly hospital initiative, including practices, and certainly stimulation at birth is a must. Immediately after birth, baby should be put on the breast of the mother and skin-to-skin contact has to be initiated. Rooming in is a must. Rooming in is a must because stimulation, power of senses, skin-to-skin is a must to enhance the breastfeeding process. You know all about the oxytocin, love bond. This is very, very much initiated in the stimulation power. And there is a lot of studies now showing that developmental brain are better myelinated, connected in breast milk infant who have breast milk neonate and infant than the control baby. This is well attested actually. And this hospital policies immediately after birth will promote certainly the early initiation and helps establishing successful breastfeeding practices from birth. I don't know how many baby-friendly hospitals are actually in Latin America. For instance, in Lebanon, among 170 hospitals, there is only one hospital who is practicing the baby-friendly initiative. It's a pity, unfortunately. Next slide. Next slide. Next slide. And those are the 10 steps, and I think that Dr. Leo has also emphasized on that. Hospital policies, the staff should be sufficiently knowledge, and we should start by implementing breastfeeding initiative before birth, and this is very important. Midwives, OBGYN do not have the time to do that. You should create a parallel team, including breastfeeding parents, breastfeeding midwives who are high knowledge, group of parents, and this is very important. Care after birth, as I have told you, skin to skin. Support mother to initiate that breastfeeding and manage common difficulties. Supplementing, no way to supplement any food or any fluid or any bottle or any pacifier. This is not permitted and certainly will break the breastfeeding initiative. Roaming in, as I have told you, responsive feeding, support mother to recognize and respond to their infants for feeding. That you know that babies at birth have a small stomach, like a berry. So if the initiation of breastfeeding will be certainly very difficult for the mother, but you have to tell her that every hour, every half an hour, or every 30 minutes, every hour, the baby will need to be breastfed because his stomach is very low capacity, and this is very important to acknowledge the parent about that. Bottles, as I have told you, teats and pacifiers are completely abundant. And we have to coordinate the discharge so that parents and infants have timely access to support and care, and this is very, very important. So before birth, prenatally, at birth, and postnatally are the time period to start and to push and to boost breastfeeding. Next slide, please. Next slide. Next slide. Public education campaigns are important. Advocacy is important. We should launch public health campaigns to raise awareness about the benefits of breastfeeding, not only for the newborn, but for the mothers. And I think the last speaker, Roxana, will certainly give us some important information on the long and term outcome benefit of breastfeeding. This will increase community support for breastfeeding and encourage more mothers to choose breastfeeding. Yes, motivation is important, moral obligation, should advocate on health benefits. It's a cheap feeding alternative. It doesn't cost anything, whereas a bottle of breast milk substitute costs at least $20. Do you imagine the benefit that we get? It's really available. Don't need to ready to put any to prepare. Next slide, please. Next slide. We should also access to breastfeeding support services. You know that low breastfeeding rate will certainly induce a normative use of formula and this will lead to a lack of breastfeeding. Societal barriers will continue, and this is a vicious circle, unfortunately. We have to provide funding We have to initiate this advocacy to provide funding for breastfeeding support services, including lactation consultants and peer support programs. Many countries and many hospitals have that program, but many of them are unfortunately costly. And this will impact on the mother. They will access to their professional help and peer support, which can be crucial for overcoming breastfeeding challenges. It's important, dear friends, to cut the gossiping of the environment. The mother, the grandmother, the the guy who is behind. Anyway, gossiping on breastfeeding should be banned. Next, please. Next slide. Next. Nutrition and week programs. Yes, we have to support and enhance programs like women, infant, and children that provide nutritional assistance and breastfeeding support to low-income families. However, my friends here, unfortunately, I am aware about the WEEK program in the United States that provides breast milk substitute to low-income families instead of stimulating breastfeeding. This is a sword with a double face. So this is very important that women, infant, and children initiative nutrition program should be targeted only on breastfeeding, complementary feeding later on, and micro and micronutrient support. Next, please. Next slide. Next slide. Maternity and paternity benefits. I have already extended a lot on that. We should extend maternity and paternity benefits to include breastfeeding support and counseling. This is very crucial and important, and I don't know how many countries will be implementing that. It's really very, very, very difficult. It's a big task anyway. Next slide, please. Next. Legislation for breastfeeding in public. Dr. Leo has emphasized also on that. Implementing laws that protect a mother's right to breastfeeding in public place. This will reduce stigma and encourage breastfeeding. Next. Next slide. Education and training for employers. That's also, you have, as I have told you before, continuing medical education program, training program on the benefits of supporting breastfeeding employees and how to create a breastfeeding friendly work environment is very, very important. Next. 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 Integrate breastfeeding support into child care regulation. This will require child care facilities to support breastfeeding practices, such as providing a space, as I have told you, accommodating the needs for breastfeeding mothers. So those are some policies and strategies that may impact benefitably, positively, the breastfeeding initiative. Next slide. Next. You are all invited to our next International Pediatric Association Congress that will be held in Mexico City between 8 and 11 May 2025. Thank you for your invitation, and I leave the floor now.
Profesor Joseph Haddad, muchas gracias por su
Professor Joseph Haddad, thank you very much for your wonderful and thoughtful lecture. You've exposed us about the importance of being able to recognize all those strategies that countries are required to strengthen and implement successful breastfeeding from workplaces with flexible break times and adequate areas for expressing milk. Also, the training of health staff to provide adequate information and counseling to mothers, compliance with the baby-friendly hospital initiative, including practices such as immediate skin-to-skin contact and rooming in, as you've mentioned, public health campaigns to raise awareness of the benefits of breastfeeding and dispel common myths, the implementation of laws to protect mothers' rights to breastfeed in public places and to normalize breastfeeding in different settings. These are all aspects that we should consider in order to bridge these important gaps that still remain in our countries for adequate and successful breastfeeding. Again, thank you very much, Professor Joseph Haddad. And likewise, we ask you to stay on the floor to answer the very interesting questions later on. We are still receiving congratulations and comments of appreciation on your remarkable presentation. Next, to address breastfeeding and the concept of developmental origins of health and disease, DOHAT from the English abbreviation, we will hear about the impact of breastfeeding on future health by Dr. Roxana Conti. She's a pediatrician and neonatologist, professor at the School of Medicine, Universidad de Buenos Aires, Argentina, head of Health Promotion and Protection Unit, Hospital Materno Infantil Ramón Sardá, Buenos Aires, Argentina, advisor to the National Breastfeeding Committee of the Argentinian Society of Pediatrics, member of the Subcommission of Developmental Origins of Health and Disease, DOHAT, at the Argentinian Society of Pediatrics, as this is a member of International Baby Food Action Network of Argentina, IPFAN in Argentina. Welcome, Dr. Conti, and go ahead with your presentation. Hello, good afternoon, good morning to you all. It is an honor for me to be here, invited by all of you, by the Andean Health Organization. It is a pleasure to have shared and share now with so renowned speakers, and I will now share my screen to kick off my presentation. I hope that you can see it very well. So we will talk about the impact of breastfeeding in future health. First of all, I would like to mention that I don't have any conflict of interest and I'm not receiving anything from any company. My commitment is to protect the right of mothers to breastfeed and to make informed decisions free of commercial or any other type of pressure. Doctor, I'm sorry, we cannot see your screen. Sorry. Segundito. Voy a poner entonces, ahí está. Perfecto, adelante. Very well. Muy bien, vamos a poner en modo presentación. Ahora sí. Hecha entonces la declaración de no conflictos de interés. Well, I've already mentioned this. We will start by taking a look at this wonderful slide. This is a drop of breast milk where we can see that this is a live cell. Every time we see someone breastfeeding, what we are seeing is a transplantation from one live being to another. And this is why we can say that human milk is fundamental for the adaptation of the human being to extrauterine life. It has stem cells, it's pluripotential, it has bacteria that we will see throughout the presentation and how it impacts health. And we can also think about an exterogestation, an external placenta, because it completes this nourishment. It completes the development which is already started in the uterus. The way we are born, the neonatal and perinatal microbiome influences the brain development and also neurodevelopment and plasticity. The human microbiome is microorganisms added to the bacterial genome that these microorganisms have, which develop together with the individual from the moment of birth and even before, because today we know that the placenta that we thought it was sterile, it is not anymore, and we have all of the human beings have a series, a huge amount of microorganisms which are with us all the time. We have millions of cells in our bodies, and all of these cells have human genes, and also we have more than 3 million unique microbial genes, and this is why we can speak about a superorganisms, which is ecological knowledge, where we interrelate with this bacteria and other agents and fungus which accompany us. So the way we are born, the way we are here in the world, it is important with the development of this microbiome that will later on have a lot of impact in our lives. In Dr. Dominguez Bello's studies, they've been out there for more than a decade. She taught us about the germs from if it's vaginal or C-section, the baby will bring the germs from the vaginal canal, different bacteria that are very important for the development of the gut of that baby, as well as other babies will, the babies will drag other types of germs. This will have an impact throughout their development. The perinatal environment generates an intestinal ecosystem, the bacterial colonization of the skin and the gut, and then motivated from this skin to skin contact, which has been mentioned before. This is an important initial contact between the baby and the mom from all viewpoints, and then, as the Friendly Hospital Initiative mentions, this will allow for the colonization and a flora which is full of lactobacillus and bifidobacteria, which is very important throughout life. When we have situations like prematurity, you the ICUN and admissions delays normal colonization when there's human milk, main source of intestinal bacteria in breastfed infants. We have the streptococcus, staphylococcus, bacteroids, and lactobacillus that will very much influence the microbiome. Otherwise, bifidobacteria is very important for their health. Bifidobacteria, we know that in case of formula-fed babies, it will be lower, and throughout life, bifidobacteria will be lost, and this is why in adults there's a lower prevalence of bifidobacteria. There are other bioactive components and specific components of human milk, also also provide health and play a very important role in nourishment. Oligosaccharides, which are those small short-chained sugars, are prebiotics. We talk about bacteria as probiotics and prebiotics, which are these oligosaccharides that will feed the bacteria. Human milk is actually a symbiotic and synergistic activity promoting prebiotics and probiotics, which are necessary for health and development. There are other active components. We have lactoferrin, which is very important because it promotes this maturation of lactobacillus and bifidobacteria. It is very high in colostrums. It's 10 times higher in human milk than in cow's milk, for instance, and it is a growth factor. Together with insulin-like and epidermal growth factors, they will play a very important role and have an impact in DNA synthesis and development of the intestinal tract in the neonatal period. As we were mentioning, the way we are born will model and will align our health. And remember that C-sections, there is actually an epidemic of C-sections in the Americas. And there are countries with alarming percentages, very high percentages of C-sections. C-sections are related to greater use of antibiotics that will affect the microbiome, premature births, exposure to infections, risk of allergies, risk of immune alterations, asthma, laryngitis, arthritis, even celiac disease, and there's evidence that could be a relationship between C-sections and development of these diseases. And we know now that all of this is very much related to the development of the microbiota. In this image, we can see different parts of the human body that will have their own microbiome, organs that we thought were sterile. We know more now that they have a very rich flora in different parts of the body, and this microbiome will affect the neurological, cognitive, and behavioral development. We see here, as we said before, either C-section or vaginal. There's a possibility of using antibiotics or other types of drugs like antacids and drugs which might alter the composition of the microbiome. The environment is also important. We live in very contaminated environments in the big cities, but at the same time, there's presence of contamination, pollution, and rural areas and faraway areas, but we receive them in the city. Toxins, fertilizers, endocrine disruptors that are very used in agriculture. Maternal stress is another element that has a lot of influence in the internal microbiome and microbiota and the way that we feed ourselves, breastfeeding or diet formula. And we will hear about their impact. Another very important element here to bear in mind, now talking about bacteria, is the entero-mammary axis, thinking that human milk has intestinal and gut live bacteria coming from the maternal gut that reaches the mammary tissue, and at the same time, they might secrete specific immunoglobulins with the bacteria that the mother has in her gut. Both the baby and the mother are in a specificity regarding their microbiome development and their bacteria that will favor mechanisms that will generate tolerance. When we talk about allergies, about inflammatory diseases, These mechanisms are very important in the prevention of these pathologies. Of course, as we mentioned, C-sections and perinatal antibiotics and the absence of breastfeeding will affect these mechanisms of imprinting early on in life. We know that the baby, the breastfed baby, starts to know the world through orality, and this will drive small intestinal lymphoid cell expansion. This is a very illustrative image about 16 different types of samples of 16 women, different women, and 3 samples of their human milk, of their own milk. And we see that there's a huge color palette here related to the diversity of bacteria that each one of them carries in their milk. And we know that when it's live tissue, we see that throughout the day in each sample of these milks, there will be a different bacterial composition. We are actually facing a live tissue, a tissue that will provide the baby receiving this milk a wealth of bacteria. These are the mechanisms that we've mentioned so far regarding what happens at the institutions, the presence of medication, antibiotics, all of this affecting the microbiome. But think what happened before, not only in the situation as to how the women reach labor, but what happened before. A teenager that will then become pregnant. How our teenagers are feeding, how they are feeding throughout pregnancy, moms, dads, and then when baby is delivered, skin to skin, contact, and so on and so forth, we have to put nutrition in the right place. As we can see here, we have elements which are not nutritious. When a baby receives human milk, they will get a wealth of bacteria that it will be exacerbated and increased, like bifidobacteria, and then we will have low risk of dysbiosis, this imbalance that is very much related to disease today. We know that dysbiosis, bacterial dysbiosis, has a lot of repercussions in disease throughout life, like pathologies like asthma, respiratory diseases, obesity, allergies. When a baby does not receive human milk, there will be the higher prevalence of the E. coli, Clostridium bacteroides, and low bifidobacteria that will promote a high risk of dysbiosis, which is related, as we mentioned before, related to allergies and obesity. There are diseases like type 1 diabetes that is related to an alteration of bacteroids in the gut, which alter the type of prebiotic, the food that the bacteria will then feed from. There's a lot of evidence today that shows that this dysbiosis that we see can be prevented when we breastfeed. And the longer, well, the better. These diseases might be preventable. And of course, what will happen then is that among the multiple benefits of breastfeeding, in so far non-communicable diseases or chronic diseases in adult life, we have the benefits of breastfeeding. It reduces obesity up to 30%. It will be greater the longer breastfeeding takes because of the concentration of the high-density lipoproteins. Type 2 diabetes is reduced up to 40%, as we saw, because of the mechanisms I've already explained, up to 30% type 1 diabetes. The inflammatory diseases and the gut will be, even leukemia and lymphoma might be reduced with breastfeeding up to 50 to 20%.
Cuando la lactancia es mayor a 6 meses. Otros mecanismos
Other complex mechanisms which have been studied, but we don't know much about, have to do with how there might be protection from breastfeeding regarding obesity. We still don't know much about the components, the presence of high-density lipoproteins, cholesterol. There's a very high energy load in favor of good fats, which are found in human milk. The bioactive components like hormones, immunoglobulins, that we all know that obesity is very much related to inflammation of the organs. These immunoglobulins will modulate all the inflammatory situation.
Cuando, digamos, la lactancia está presente. Entonces, hormonas como leptina, insulina, que además también promueven
insulin, that promote gut development, ghrelin, leptin, that will control appetite in society, and also the palatability of someone who breastfeeds is much better than someone who's receiving formula. Breastfeeding grants a diversity of flavors, which is so wonderful. And there are other mechanisms that have to do with the epigenetic and metabolic programming, with leptin gene methylation, apart from the mechanisms that we heard about with the presence of bifidobacteria and bacteroids that will protect obesity from obesity. So we have obesity happening because of different mechanisms, and breastfeeding protects from developing it. Another important aspect is that of brain development, the presence of long-chain fatty acids, docosahexaenoid, DHA and AA, which have a huge impact in the development of an immature brain. They promote and produce brain development, even 2.5 points with the IQ measured, mediated by white substance in breastfeed babies. And there are other elements such as thyroxine and growth factors like nervous growth factor that will promote the proliferation of glial cells. And we know that as brain microglia has the immune structure of the brain. When this happens healthy, we will also have important prevention of diseases. Cholesterol. We have mentioned cholesterol as a fundamental element. It's a component of myelin membranes and rate-limiting factor in brain maturation. There's massive postnatal synapse increase that requires greater amounts of cholesterol. The cholesterol intake through a white matter volume. This image is to illustrate the concept of epigenetics. This circle that we see here showcases what happens in the nucleus of a neuron. In this case, there could be another cell involved. And as we know, there are chromosomes as important elements in the nucleus, where there's the information that we bring with us, all human beings bring with us. But when we deploy these chromosomes, apart from the double helix, we see the circles here that show the proteins which are related to the DNA, and their mechanisms which do not have to do with genetics, but they are epigenetics, meaning that they are outside. And today we know that they play a very important role in the development of health and disease in the long term, because these mechanisms involve alterations, enzyme alterations, methylation of DNA, methylation of the cystones, these mechanisms which might create disease. So everything that reflects the environment to which we are exposed, if it is a healthy environment, we will be healthier. But if this is adverse, we will develop disease because of these mechanisms. This is an illustration of what we mentioned before about the human brain development. We have 0 with birth, and we can see that the synapogenesis that has to do with seeing, hearing starts to develop in this time, but at the time of birth, we already have the maximum development of this synapogenesis. What about language? A baby will develop language beyond 2 years of life. However, the ultimate development time of synaptogenesis that will allow language will happen around 6 months before the year in this crucial development of human development. So likewise, cognitive functions that will then allow us the understanding, abstract understanding, and so on and so forth will happen at the peak time of this synaptogenesis around the year, meaning that everything that happens since conception and the 2 first years of life, the 1,000 days, will be actually a good opportunity window, and hence it is important to look after pregnant women with prenatal care and the time of birth because of everything that we've just mentioned. Hopefully, we will have skin-to-skin contact immediately after birth, and early start of breastfeeding and duration of breastfeeding for the first 2 years of life.
Del cual recién hablábamos y que nos va a garantizar salud.
And all of this will guarantee health throughout life. Here we can see the conception, birth, the first year, the second year, and all of this as a window that will allow for the maturation of the microbiome and all of these elements that are adequate in this first phase of life.
Un impacto esencial, muy importante. Entonces, ya para definir el
to start defining the Doha concept, which is the origin of health and disease development in the life course, this mainly focuses on the prevention. It's prevention of an adverse environment from the origin of life. Obesity, type 2 diabetes, hypertension. This is another pandemic that is affecting the future of the planet. These diseases are responsible for more than 60% of deaths worldwide and 80% in the region of the Americas. In the past decades, there's been an increase, sharp increase in the last 2 decades. Maybe regarding the inadequate food, ultra-processed food, and so on and so forth, many of the things that we've mentioned. So we now can say that human milk modifies health of the species. It provides essential nutrients that will have a consequence on the present and future health, especially in vulnerable preemies or hospitalized babies because of different causes, the use of antibiotics, and so on and so forth.
Y sobre todo va a ser muy
This
importante.
will make them more vulnerable, and it will be important. A lot of our efforts are focused on guaranteeing human milk for preemies and sick babies as well. This is an image to close and to summarize what I've just presented. The first 1,000 days, this timeline where we have the three fundamental mainstays: nutrition, microbiome, and epigenetics. Maternal nutrition with the nutritional status before pregnancy. We have long-chain polyunsaturated fatty acids, environmental contamination and pollution, and disrupting elements, nutrition of the baby with human milk, probiotics and prebiotics, and some formulas that will have a negative impact. Microbiome, diet, exposure to antibiotics, and environmental contamination will mold this microbiome and the epigenome, which is not only related to genetic information, but also to environmental factors that will modulate the information of our genes. This meta-analysis was published in 2016. I consider was a change of paradigm by the group of Dr. Victoria, where there's an evidence between breastfeeding with the protection against overweight, diabetes, and non-communicable diseases in adulthood and breastfed infants. In this publication, Dr. Victoria mentioned if we could bring breastfeeding to a universal level, the deaths of 823,000 children under 5 years of age could be prevented annually. And in the same period, the deaths from breast cancer of 20,000 breastfeeding women could be prevented, because remember that all of these benefits are not only regarding breast cancer and other types of cancers, but also there are lots of benefits in the cardiovascular apparatus of the mom, prevention of obesity and diabetes in the person that breastfeeds. In this other study of 2015, there's association between breastfeeding and intelligence, education attainment, and income at 30 years of age. This is a prospective birth cohort study from Brazil. It's been followed by up to 30 years with spectacular results. And here we can summarize like breast milk is a masterpiece of mammal evolution. We can see here these large animals with poor cognitive development. They have a specific milk with specific contents for their species. We have a preemie receiving breast milk, and this is always the mainstay of health and development. I would like to share this work when we were mentioning the presentation of an external placenta. This research group compared the proteome present in rhesus macaques and humans, and there were differences in neonatal nutrition in these species. The more abundant proteins in human milk compared to macaque are associated with the development of the gastrointestinal tract, the immune system, and the brain. And these researchers concluded that the difference in protein abundance observed, human infants compared to non-human primates are born at an earlier stage of somatic development and require additional support through higher amounts of specific proteins to nurture the maturation of the human infant. Human milk is not only a perfectly tailored nutritional intake for the infant, but probably the specific personalized medicine they need. More advanced that they will ever receive during their lifetime, given in a time when gene expression is being delineated for life. Thank you very much. And I hope that we will have a great week. Thank you. Dr. Conti, thank you very much for your wonderful and thoughtful conference. Very impressive how you've shown us the importance of the perinatal and neonatal microbiome and how it influences the brain development and neurodevelopment of the future individual. How the way of birth models the acquisition and structure of the microbiota in newborns. It should be noted that in many countries, many of our countries, C-sections are increasing, which deprives the newborn of contact with the vaginal flora, which you've mentioned already affects neurological, cognitive, and behavioral development. It is also important to note the notorious benefits of breastfeeding by reducing the incidence of obesity up to 30%, as well as of type 2 diabetes, which reduces the risk of suffering it by 40%. Alarming figures that we cannot handle. The mechanisms of how human milk stimulates brain development are widely demonstrated and recognized. And hence, the concept of DOHAT, development of health and disease in the life course. This is why it focuses on the prevention of an adverse environment from the origin of life. You have shown us how human milk modifies the health of the species and how it is key in the health-disease balance, especially in vulnerable individuals. Interesting also to acknowledge the evidence that breastfeeding is associated with a better performance on intelligence tests up to 30 years later. And this may increase the educational attainment and income in adulthood. Very interesting presentation. We ask you to stay in the room. We will still receive questions and we will start a discussion with the three speakers to answer them. We thank all the people connected from the ministries of health, the academia, various entities and social organizations of Argentina, Bolivia, Brazil, Colombia, Cuba, Guatemala, Honduras, Mexico, Paraguay, Peru, Uruguay, Venezuela, among others. We have received many greetings and congratulations that we thank very much. To begin this dialogue based on the questions posed, I would like to ask the speakers to please turn their cameras on. Dr. Leo, because he's here. He's here, but I'm sure that we will be able to answer the questions. Leo is here.
Pude modificar un compromiso.
Yes, he's here. He's here. I'm sorry.
Va a ser difícil que prenda la cámara. O quizás sí, no lo sé.
Sí.
Ok, comencemos.
Vamos viendo. Doctor, pregunta entonces para el doctor Nederving.
Question for Doctor. In our changing world, how do climate change, forced migrations, and the economic crisis affect the warm chain of breastfeeding support?
Pues una pregunta muy
This
relevante.
is actually a very relevant question, and of course,
Cambio climatológico,
climate change and migration affect very much. And we see this in migratory movements that breastfeeding is always under pressure because it breaks the support. It's having difficult access to services. So definitely this affects breastfeeding. And having said this, under these circumstances, it is even more relevant in there's even greater risk of using substitutes, even more so if hygiene is not good and if water is contaminated and if artificial milks are diluted, the effect is even worse. So it is of the essence to do everything possible to keep breastfeeding, which is
mejor para la salud y el desarrollo
safest
del niño.
for development of children. And maybe say that the production of formula is one of the contributing factors to climate change. Many of this production will go hand in hand with the destruction of the environment, of the traditional crops and deforestation. And well, this of course contributes to climate change. It's a vicious cycle, I would say. And this is why we have to promote breastfeeding. And promote breastfeeding, it means to promote the ecosystem and fight against climate change and plastic contamination also. Thank you, Doctor, for your answer. Question for Professor Haddad. Don't worry, Professor, if you
Yes.
cannot turn your camera on. Thank you very much, Doctor, for being here. Okay, so the question is there evidence of the effect of maternity and paternity leave on the adequate consumption of breast milk in the first years of life and on the nutritional status of infants? What policies do you consider relevant to implement from the labor sector, considering that a considerable percentage of workers in a region are in the informal sector? Go ahead.
Yes, thank you for this very interesting question. The issue is, where are we staying? Are we staying in the low middle income countries, or are we living in a high income countries? There is a big difference between the two situations. Second, as has emphasized Dr. Leo previously, that climate change, environment, everything will affect it. So I think that we don't have a really very adequate response to this question. It is very difficult to answer. And I think that maternity leave, more than, for instance, in Finland, they are giving almost 6 months or 12 months maternity leave. And this will allow the 6 months breastfeeding. And if you look into the epidemiological studies of the northern countries, cancer, obesity, asthma, etc. You will, sorry, and if you compare it to the other countries, you'll see that in those countries where you have this increased maternity leave, there is a decrease in the occurrence of cancer, of obesity, of asthma, and so and so and so. Is it related to the maternity leave, to the breastfeeding? That is a big question mark. However, I think that there is a clear correlation between that. And this is what Dr. Roxana has emphasized, that more you breastfed, more you will have a healthier infant. More you will have maternity leave, more you will be you will have a favorable outcome. But the question is really very difficult to answer. Sorry that I did not adequately answer to it, but I have maybe given some spots on it. Thank you.
Muchas gracias, profesor Haddad.
Thank you very much, Professor Haddad. Question for Roxana. Our region is characterized by an excessive increase of C-sections. Is there evidence of their impact on the intestinal microbiota? Are there mechanisms to address them through breastfeeding? Thank you very much for your question. Yes, indeed, this has a greater impact on the early microbiota, as we've mentioned throughout the presentation, because when there's C-sections, somehow the baby is dragging the skin cells. It's been shown that the microbiota will be different and wealthier in skin cells. If we consider this with the baby born through the vaginal canal, will have different germs associated to the vaginal canal and the perineal canal. However, there are studies, very interesting studies, as I showed before, from Dr. Bello, where in the C-sections with a they can receive a cloth immersed in the vaginal secretion that will populate these cells with the baby. Of course, skin-to-skin contact at the time of birth, even when there's no vaginal delivery, even skin-to-skin contact will hugely benefit the baby. And when we can put the baby on the breast, we will also have a greater benefit. So there are ways of promoting breastfeeding.
Y como bien comentan en la pregunta y hemos mencionado en la presentación, realmente es muy, muy preocupante el aumento de las cesáreas en el área de las Américas.
Muchas gracias por su respuesta, doctora Conti. Pregunta para el doctor Leo Nederving. ¿En qué se diferencian las campañas de marketing de fórmulas artificiales para bebés en América Latina del resto de regiones del mundo? ¿Se recomiendan políticas o intervenciones particulares más agresivas?
Buena pregunta. No sé si en realidad se diferencian mucho entre las regiones. El estudio que mencioné, donde se vio que hay 55.000 millones de dólares al año que las empresas productoras de lácteos, digamos, de las fórmulas infantiles, gastan esos
So
50
they spend
mil
this
millones de dólares al año
$50 billion per year in Mexico. Mexico is one of the countries which has participated in this trial with the UK, India, and actually it's a world problem. and there's less regulation.
Hay más opción, digamos, de infracciones
And there's
y no cumplimiento con el código
more
internacional
non-compliance with the
comercial
international
de la
code for the marketing of
a
breast
veces
milk
se dice
substitutes.
que los ministerios de
Sometimes we
salud también
say
deben
that
hacer
ministries of
campañas
health
de educación,
should campaign
pero
also and
el
educate, but
presupuesto
of
que tiene
course
un
the
ministerio de
budget that a
salud
ministry
es
has
nada en
is
relación a
nothing.
todo el presupuesto que
Nothing with
tienen las
regards to
grandes
the budget that
compañías
the
para
companies
hacer
have
esta
regarding
publicidad, ¿no? Y
this.
son cada vez más ingeniosos,
And there's
sobre todo a través
more
de
creativity, and you
influencers
know
en redes
that
sociales
influencers on social media
hacer actúan como
are
colegas de
acting
la
like
nueva mamá, o sea,
friends of the
antes
new
de que el
mom,
bebé
and
nazca,
before
ellos
even
ya
the
saben
baby
a
is
quién
born, they already
deben
know
dirigirse.
who
Entonces,
they should go to. So this is
definitivamente
actually
es
something
importante
that
una regulación y
we
leyes
should
mucho más
regulate
estrictas
on
y
work
sobre todo
on, and
más
especially
vigilancia, más seguimiento a las
in terms of
infracciones y
following up
también sanciones
and
deben
sanctioning those who
implementarse
are not
sanciones
complying.
efectivas. Y esto pues no solo es en la comercialización, digamos, pero también el propio personal de salud, ¿no?
The
No
health
deben haber
staff should not
sucedáneos de la lactancia materna
include
en los hospitales, ni las
or
marcas, ni
make
debe haber patrocinio de
them
congresos,
visible. There shouldn't
así a
be
menudo de pediatras, de nutricionistas, también de
sponsors of
personal de salud
pediatricians or
pidiendo
nutritionists in
apoyo en
congresses,
las
because
formulas
sometimes
farmacéuticas. Entonces,
these formulas are being
promover
sponsored
y
in those
asegurar
congresses. We
colaborar
all
con
have to be part
el cumplimiento
of
de la misma.
this effort.
Muchas gracias, doctor Nedervin, por la
Thank
respuesta.
you very much, Dr. Nabedin, for this answer. Question for Dr. Joseph Haddad. What policies are essential? I don't see him. I don't see him in the room.
A ver,
Capaz se desconectó.
Maybe he logged off. If he logged out, we don't know. Let's wait.
reconectarse, dentro un ratito yo leo. Me comunico. Voy a pasar entonces a pregunta
So
con
now,
la doctora
question for Dr. Conti.
Doctora Conti. Tenemos la
Dr.
siguiente
Conti,
pregunta para usted. Cada vez hay mayor evidencia
there is
de la
increasing evidence
infestación de
of microplastic infestation in the ecosystem. Are infants also exposed? How to reduce their exposure from breastfeeding?
Una pregunta muy interesante, muchas gracias.
This is a very interesting question and a very complex question, by the way, because plastics are infesting and investing us from everywhere, even through water,
y por supuesto todo esto puede llegar a la
and
leche humana.
this can get to
La forma de
breast
reducirlo,
milk. The way to reduce this, well, we know that we will be able to reduce this if we develop healthy habits in our own life, in our households, and the food that pregnant women receive, the food that breastfeeding moms will receive. Of course, this will have an impact. But in the world that we live, it will be very difficult because plastics are absolutely everywhere. So I think that through our habits and from environmental assessments, everything that we could do will be important. But as Dr. Netherbean has mentioned, and the Sustainable Development Goals viewpoints, I would like to mention that breastfeeding is an essential element for the accomplishments of the Sustainable Development Goals because they contribute to the reduction of plastics with the reduction of greenhouse gases, among others. And all of these elements, contaminating elements, will go back to the oceans. So promoting breastfeeding practices is also promoting a healthier and less contaminating world. Thank you very much, Dr. Conti. We continue with Dr. Nervi. Our countries are multicultural and therefore breastfeeding is perceived in different ways. Are there experiences of dialogues of knowledge that promote practices and environments that support adequate breastfeeding? Well, could you repeat the question, please? They say that our countries are multicultural, and therefore breastfeeding is perceived in different ways. Are there experiences of dialogues of knowledge that promote practices and environments that support adequate breastfeeding?
Experiencias y diálogos.
Experiences and dialogues. Well, yes, I think that there have been, especially regarding community work. There's health services that play a very important role in promoting breastfeeding, and I would say through the life cycle as well. And now talking about breastfeeding in the prenatal consults, but also at the time of birth and in the first year of life. That should be part of everything that relates to the midwives, which are important at the community level as well. Healthy family strategies where there's a role of the dad and the mom and the mother-in-law and all of these experiences which not only depend on the culture because we have increasing urbanization where family links are less strong and there might be more urbanity, but there are still rural, traditional communities that, of course, have an influence.
Las áreas rurales se protege la lactancia materna, también ya en países más desarrollados a veces son depende también del nivel socioeconómico.
This depends on the social, economic level and the knowledge. So if we want to promote breastfeeding, we need to investigate a little bit more to see what are the barriers for women to be able to breastfeed. Cultural aspects are also very important. And, well, thank you, doctor. Question for Dr. Conti. Can self-medication with antibiotics in breastfeeding mothers affect the microbiota neurological development of their nursing infants?
Pregunta. Absolutamente.
Absolutely. Self-medication is a practice that we should discourage, but the use of antibiotics definitely has a very strong impact on microbiota, specifically in cognitive and neurological development. I could not establish a direct relation, but the cognitive development is very much related to healthy microbiota. Everything that alters microbiota can have an influence. So
digamos, remarcar como respuesta es que el uso de antibióticos
the
y de
use
otros
of antibiotics
medicamentos
and
también,
other
como por
drugs,
ejemplo los
such
antiácidos
as
y medicamentos que
antacids
afecten
and
las
medication that
bacterias
will
del tracto
affect
digestivo,
the
van a tener un
bacteria
impacto
of the
significativo en la
digestive tract
alteración
will
de
have
este
an
equilibrio, de
impact
este desbalance
and
que
this
puede conducir a
and
una
balance
disbiosis,
that
como
might
ya hemos
lead
visto,
to
que se
dysbiosis, and
relaciona
it
con
is much
diversas
related to
enfermedades
different
a lo largo de la
diseases,
vida. Así
as
que
we've
los
mentioned before.
antibióticos en todo momento de
So
la vida no deben ser
antibiotics should
automedicados,
not be
pero bueno, tener mucho cuidado con la
self-administered at
indicación de antibióticos en
any
mujeres
time
embarazadas,
in
en
life, especially with
perinatal,
pregnant women in the
realmente
perinatal
cuando se indican deben ser claramente indicados por
phase,
un profesional y
and
con
they
una causa
should
bien,
be
bien justificada.
prescribed by a physician with a justified cause, of course. Thank you very much for your answer, Dr. Conti. Question for Dr. Neveline.
¿Cuáles son los estándares de la iniciativa de hospitales amigables con el
What
bebé?
are the baby-friendly hospital initiative standards, and how could it be connected to women, infants, and children nutrition assistance program?
Perdón nuevamente.
I'm sorry again, you will have to repeat.
Hospitales amigos del
Are
niño.
you asking about baby-friendly hospital initiative? Yes, and how might it be connected to a women, infant, and children nutrition assistance program?
Okay, ahí están los 10
Okay,
pasos.
so we have the
Creo que lo
10
hemos
steps.
visto
I
en
think
la
that we've
presentación
discussed them at length
del doctor.
throughout
Se me fue el nombre.
Doctor's
Voy a
Haddad presentation.
Sí, sí, voy
Professor
a
Haddad,
poner
yes,
en el
I
chat
will
el documento más
share
reciente. Ahí están
the
los
most recent
10
document through
pasos
the
y
chat box.
también hay 9 criterios que presenté
And
que
there's
son los criterios
9
para,
criteria that I
digamos,
shared
ver las políticas
that are those
nacionales en
used to
relación
promote
a la
national
disponibilidad
policies.
y en relación al financiamiento y en relación a la evaluación externa y
And
están los 10 pasos
also
que son los estándares,
the
digamos,
10 steps that are the
epidemiológicos
standard.
para ser considerado amigo del niño. En cuanto a la asistencia nutricional,
Regarding
no voy a
nutritional
responder la
assistance, I
pregunta
see
independiente,
this as an
porque si
independent
estamos
question,
promoviendo la
because
lactancia
if we
materna,
are promoting,
bueno, es el único alimento que
well, this is
necesitaría
the only
el
food
niño, por lo menos
that
hasta
the child needs,
los 6 meses. Y bueno, la asistencia nutricional debe
and
ser un
nutritional
último
assistance needs to
recurso. Lo
be
que
the last
realmente
resource.
queremos es promover la
What we
seguridad
want is to
alimentaria y
promote
nutricional a nivel de los
nutritional
hogares sin necesidad de asistencia nutricional.
assistance.
Si hay necesidad, pues sí hay esquemas de protección social y
It's actually
a menudo es preferible
something that
una
is
protección social a
preferable.
través del dinero o generación de ingresos que dar un alimento, que a menudo es un alimento procesado, que tampoco es lo ideal.
And
Entonces,
processed food is
debemos
far from
promover una
ideal. We
alimentación
need to
saludable
promote
y
healthy
proteger a las
food and
familias
protect the
de
families from
caer
the
en la
very beginning and prevent them from falling in poverty. Well, thank you very much, Doctor. To finish, we would like to thank each one of our speakers to and give a message in less than 1 minute. Dr. Navarrete, for your
Bueno,
message.
muchas gracias. Yo creo que mucho ya
Well, thank you
se ha
very much.
dicho.
Much has
Definitivamente,
been said.
gracias a
Definitely,
todos por estar acá,
thank you
por el
very much
interés en
for
la
being
lactancia
here,
materna.
for the interest in
Necesitamos un
breastfeeding.
gran
We
movimiento
need to
entre el gobierno, la
create a
sociedad civil,
movement between the government, the
familias,
civil society,
sectores
and the
y
different
promover la
sectors and promote
lactancia materna. Considerar que es el mejor alimento, el mejor antibiótico, el mejor
and
afecto que podemos dar a nuestros hijos
this
y
is the
hijas
best
y
thing that we can give to our
recordar
children.
que la lactancia
And
materna sirve
remember
para promover todos los días semanas del año, bueno,
that
particularmente en esta semana
breastfeeding needs to be promoted every day, not just throughout the breastfeeding week. This is the responsibility of all of us. So thank you very much for the invitation. Thank you very much. Dr. Conti.
Bueno, muchas gracias por el espacio.
Thank you very much for the space.
Bueno, mi mensaje
And
es,
my message would be
promover la lactancia,
to promote
promover la salud presente y futura,
breastfeeding, and it
y prevenir
is
las enfermedades en el
preventing
curso de la vida.
disease throughout the course of
A partir
life,
del conocimiento y la
and
evidencia
through the
científica
knowledge and the
acerca de los
evidence that we
mecanismos
have about the
genéticos, la
epigenetic
importancia del
mechanisms
microbiota, de las
and the
células madre y
importance
de los
of
orígenes del desarrollo de la
stem
salud y
cells and
enfermedad,
the
la lactancia
origin
tiene un rol esencial en la construcción de un mundo
of
mejor
everything.
para las
Well,
generaciones
breastfeeding
futuras.
has a very important role to
Estos
play for future
conocimientos además nos
generations. This
permiten
knowledge
definir
also
programas y
allows us
políticas
to outline
públicas y
programs and
campañas de
public policies and
concientización y
campaigns
de promoción de la lactancia
for
para una sociedad más
promoting
justa,
breastfeeding for a
una sociedad
fairer
más sana
society, a
que pueda
healthier
alcanzar sus
society that
objetivos de
might
desarrollo.
reach the
Lo
development
celebremos y
goals.
tengamos una feliz semana. Muchísimas gracias por la invitación.
Thank you very much for the invitation. We thank our two speakers. We would like to thank Professor Haddad had something else, and he's thanking and acknowledging the high level of the webinar, a high level of this webinar, and he says that we should continue working for this. Excellent. Well, thank you very much for your questions. We don't have time to answer them all, but we will have them in mind to for the next webinars. We treasure your participation. We would like to reiterate our gratitude to Dr. Haddad, who had to leave, unfortunately, a little bit before, but he gave us a brilliant presentation. Dr. Navdeen and Dr. Conti, thank you very much to you all, to all the participants, to the Orasconu team, and all of the people who are part of this activity, who have made this possible thanks to the commitment towards Andean and Latin American integration. I will hand the mic to Dr. María del Carmen Calle Dávila, Executive Secretary of the Orasconu.
Mis primeras palabras son de agradecimiento.
I would like to thank you for this week. Tomorrow, well, on Tuesday, we had a meeting, we had a webinar about the formulas and everything that's been said. And today, we will improve and complement the information that we've been sharing.
Me ha encantado.
And I love this very much. We've talked about policies and how the standards are doing and the situation, and then we've mentioned the practical examples to implement the breastfeeding and the last time we've started working on this relationship with microbiome. We've started to talk about this. And why am I thanking? Because definitely I'm a pediatrician and I've been favoring breastfeeding for a long time. And I've always had problems with the laboratories because they were staring at me and saying, "Doctor, we know that you won't prescribe our milk, but we have to do our work anyways." What I would like now is to work on this motto, which is very clear. What does it tell us? Close the gap, close the gap. And this is what it says, but what I would like to tell you all of you, imagine a world where each baby has the opportunity of growing strong and healthy from the first day. A world where breastfeeding is accessible to everyone without regard of who's the person or where it's coming from. Closing the gap, support breastfeeding to all is not just a motto, it's a call for action. And Dr. Leo, Hus, Roxanne, and Joseph, all of them have mentioned that this is a call for action. We are called for action for a lot of time since I started with medical school, but the important thing it is direct. Together, we can make sure that each mother will receive the support that she needs to breastfeed, providing our children the best start possible. Together, let's close this gap and let's nurture not only the present but also the future. I think that those who are truly convinced are here, but we need to convince others. And convincing is not only about motivating, convincing is providing the tools, providing the legislation, providing all the facilities that are necessary to do this. I have 3 kids. I know what I'm talking about, and I breastfed all of them. With the third, I took my baby to work. He was working with me, but and I always share this, when I installed a cradle, no one was able to bring their children because they spent a lot in commuting, and what they earned, it was not enough. So this is how it is. It is. Joseph said, when we are talking about work conditions for mothers, we really have to add this highlight. We have to make this more real. It is not enough to add lactation units. In most of our countries, most have informal work or they work at small institutions where not even 20 women in reproductive age work. So there are no breastfeeding spaces. We should look for other ways for these women to keep on breastfeeding. Then not only it is about giving birth, it's C-section. Right now, there's a number in Peru. In the last year, 38% of C-sections have been registered, 37% C-sections, 4 out of 10. And we know everything that this entails. And third, what Leo mentioned, everyone has something to do here. This is not individual. This is a family issue. This is an issue that has to do with communities, with health workers, and this is an issue that involves decision makers and civil society, because we want to have better people, better children in better conditions to have a build and better country. And I think that this is the only thing that it's not arguable. There's no left or right or center. We all agree that we want to have a better country, and the way to have a better country is with better people. The only way of having better people is this being proven by breastfeeding, because it's always been fabulous, and year in, year out, there are more studies that prove that it is the right option. I remember when I was working, I told moms, breastfeeding is more or less in the roof. All the other strategies are not in the basement. So then you can have an idea of what it's all about. But we have a lot of marketing, a lot of lobbying, and well, we have so many things to face. So we have to be stronger from where we are. We all have something to do wherever we are at to contribute to really having effective breastfeeding. Much of discussion up to 2 years, 4 years. Leo says it's up to 36 months that will be compared. I think that this is fabulous, but there's a lot of world discussion if it should be 5, 4, 6, 8. Well, this is something that also relates to the culture, but there's something that is also important as the formulas. How are these formulas? Formulas that come to Latin America have more sugar than those formulas in the north. No one says this, but I dare say it. This is definitely, and this is different. I don't mean to say that you should use formulas, but this is an inequality being registered, because when we talk about breastfeeding, we are talking about prevention of non-communicable diseases. It's not the peanuts. We are talking about all the budget that it's being held in public health. It's not only about obesity, it's diabetes, hypertension, chronic renal failure or disease. And I think that this is a call for action, and the Horas CONU feels very happy of having these two webinars. On Tuesday we have it, and today we are having it. We're barely starting breastfeeding week, and we repeat what we've always said, and something that makes us be convinced. Together we are stronger, and together we will reach farther away. We invite you on Thursday to our next webinar, and the topic will be the importance of communication in the implementation of programs and projects, because it isn't useful to share things amongst us if we do not know how to communicate. As a colleague said, if we do not know how to communicate this to laymen. We've heard very interesting things here, but it is important to know what people understood. I'm honest. When they talk about antibiotics, I get a little bit nervous because they hear, let's not prescribe antibiotics. They are not hearing what Dr. Conti said. Whenever there's an indication, a professional indication, we have to use it. But everyone will register, okay, we should not receive antibiotics. And this is still a big problem that we are not resolving. Communication capacities. This is why you are invited for Thursday. This is not the same channel, but this platform. Thank you very much, Roxana, Leo. It's been an honor to have you with us. Thank you.
Gracias.
Thank you.